Hello, my name is Donna Pratt. I'm a nurse practitioner student. I'm going to be performing a head-to-toe assessment video. For the sake of the video, at times I will be doing only one side to cut time down of the patient. I'm at my patient's home. Hello, my name is Donna Pratt. I'll be your nurse practitioner today. Can you tell me what your name is?
GP.
And your age?
52.
Are you comfortable enough, sir, before we begin?
Yes, I'm fine.
And what brought you in today?
Just check up.
Okay. First of all, if it's okay with you, I'm going to check your head. I'm going to look at your head and make sure that it's normal and it's in good alignment for the body position. It is normal cephalic. The collar appears to be good on it. Now I'm going to check your head for texture. His hair is thicker at the back side of his head, thinning at the top. I'm going to check your back of your head for masses, any indentations, anything like that, sir. Any dandruff, any problems with lice or anything like that. Okay. Any masses, any trauma to your head, sir?
No.
Okay. It looks like you have a little dent right here, but that's the only abnormality I see. Now I'm going to palpate and check for the same temperature, and at the same time I'm going to check your sinuses and your face for trauma. Any problems, sir?
No.
Okay. Next thing I'm going to do is I'm going to check your lymph nodes. Have you ever had that done before?
No.
Okay, so I'm going to start at the back and I'm going to feel around and under your neck and around your ears, and you tell me if you have any issues or any tenderness. Okay. Start at the back, doing your occipital lymph nodes. Do you have any problems there?
No.
Okay, I'm going to do your post-auricular, the ones behind your ear. You tell me if you have any problems there. Any tenderness, soreness? I didn't feel any enlargement so far. Your pre-auricular. Any problems there, sir?
No.
Okay. I'm going to check for your carotids and your retropharyngeals. Any problems there?
No.
Okay, at the angle of your mandible. And then between the tip and the angle, I'm checking for some more lymph nodes. Any issues?
No.
I'm checking for your submental underneath your chin. Any problems there?
No.
Okay, the next thing I'm going to do, middle ones were your submandibular. I didn't feel anything there. Next thing I'm going to do is check your neck, and I'm going to check your neck lymph nodes, your anterior, your posterior, and then I'm going to go in and get deeper with my hands. Check your deep ones. Any problems there, sir?
No.
Okay. The next thing I need to do is I'm going to give you a cup of water, and I need you to take a swallow. I'm going to check your throat here in a minute, and I'll let you know when that happens. I'm going to hand you a cup of water and so you can be ready for me, okay? I'm checking your throat for goiters, any masses, any issues with swallowing, anything like that, okay? Okay, lean your neck up for me, please. I'm going to check your cricoid, notch, and your cricoid cartilage, and all your throat cartilage, and make sure everything's okay. Go ahead and take a drink for me. Any problem swallowing?
No.
Just checking your thyroid now that I felt it move whenever you swallowed. It's movable, it's palpable, doesn't have to have any issues there. I'm going to put a stethoscope on your neck here just in a minute. I'm going to check your carotid pulses first. I'm only going to check one so I don't occlude it, both at the same time. And I'm going to check the other side of your neck. Okay. Like I said, for the sake of time, I'm only going to check one bruise on his neck on the right hand side. Okay, sir, I need you to hold your breath for me. I want to also check your thyroid for any bruise. I don't hear any extra sounds or any swishing, so you don't have any problems with your thyroid. Do you have any questions about that?
No.
Okay, the next thing I'm going to do, sir, is I need to do a check your eyes. I want you to close your eyes for me. I'm just going to touch your eyes and palpate around, check them, touch them, see if there's any. Can you tell me if there's any soreness? No?
No.
Okay. I'm going to check your lacrimal glands to make sure there's no drainage or no issues there. I don't see anything. Next, I'm going to have you to do an eye exam for me. You have your glasses. Can you tell me the lowest, read it in a comfortable distance for you? Do you need to turn on any more lights, or are you okay?
That's fine.
Okay, can you read it with both eyes?
9374258.
Mm-hmm.
You can see him one there, then you got the XXO 52 20/30.
Okay, can you close your right eye and read with your, or close your left eye and read with your right, because we're only checking your right vision. For time's sake, we're checking on one side.
428365 WEM OXO 632040.
Okay, the visual acuity is checking the optic nerve with the visual acuity test and the visual fields, which I'm getting ready to do next here in a minute, okay? So you did pretty good with that. Do you have any problems with your vision, sir?
No.
Okay. I'm going to take my fingers and I'm going to check all your visual fields. Can you tell me if you're having issues, okay? I'm going to go down as far as I can. You tell me when you start seeing my fingers.
No.
Okay. Up as far as I can.
No.
Okay. And then I'm going to go to the side as far as I can.
No.
Okay. That checks his visual acuity. He did pretty good with that. He didn't have any issues. Next, I would like to check your peripheral vision fields. So I'm going to have you to look up as far as you can, and look over as far as you can, and look down as far as you can. And this is the 6 cardinal signs of gaze. It tests cranial nerve 3, 4, and 6. Okay, look up again as far as you can, look over as far as you can, and look down as far as you can. Okay, do you have any questions about that, sir? You
No.
seem to do good with that test. Okay, the next thing I need to do is I need you to take off your glasses so I can check pupil reaction in your eyes. I'm going to also check for any corneal issues like corneal opacities or anything like that in your corneal reflexes. Now, if I'm checking with your corneal reflexes, that checks cranial nerve number 4. So, any issues there, sir?
No.
Okay, now I'm going to check direct and consensual. Okay, so I'm going to shine the light into your eyes twice. Okay, once to check your pupils are reactive and equal reactive to light, so good perla. Then I'm going to check it again. Hold this side open as far as you can for me, because I should see this one dilate. Okay. Direct and consensual is good. The next thing I'm going to do is I'm going to do a red reflex in your eye and check it, okay? So this may be a little bit uncomfortable. Your eyes may water a little bit. You have any questions? Okay.
No.
Okay, can you look at me, sir? Okay. I'm going to do the right side because I'm closer to this side. Let me turn my light on. Okay, got the red reflex. I'm going in adjusting my light to 10 so I can see what's going on in there. Okay. I can see the optic nerve. It looks intact. The optic disc looks good. There's good color. It's bright. It's yellowish orange in color. The fuvula is brighter than the rest of the stuff in there. I don't see any microaneurysms. I don't see any hemorrhages, and I don't see any neurovascular issues. Do you have any questions about your eyes? Have you had any blurred vision or anything?
No.
I don't see any AV nicking or anything like that as well, so it looks pretty good in there. The macula looked good as well. The next thing I'm going to do, sir, is I'm going to check your ears, nose, sinuses, and your mouth. Okay? Do you have any questions about that?
No.
Okay. The extraocular motion movements that we did earlier, checking his different ocular areas, was for cranial nerve number 3. So, in case I forgot to mention that. Now, I want you to do me a favor before we do that. I want to do cranial nerve number 4. Can you frown for me? Can you smile for me? Can you puff out your cheeks for me? Okay. Any problems with that?
No.
Okay. Your face looks nice and symmetrical. I don't see anything whenever you do that. So next I'm going to check cranial nerve number 5, which checks your hearing, sir. Okay. I'm going to do what they call a whisper test. Okay. Before I do that, I'm going to check your ears. Your ears feel okay. They look okay. They look aligned to your face. Your auricles look okay. You're no tenderness or anything there. I'm checking your tragus. Okay. Now I'm going to occlude this ear. I'm going to whisper over here, and you tell me what I say. Okay, so that's the whisper test. Now I'm going to do a Rinne and Weber test too, sir, on you, okay? Checking with my tuning forks here. I'll put this tuning fork on your head. I'm checking for lateralization in both of your ears. Okay, so you tell me when you stop here, which ear you hear this sound in the first. Which ear did you hear it in?
None.
Okay. Either?
No.
Okay, let's try again.
No.
Which side did you hear it in the best? Left or
Side.
left side?
Left.
Okay. And then I'm going to do the one behind your ear. Oh, let me go over on this side so they can see what I'm doing. Sorry. I mean, when you feel that stop vibrating.
No.
Okay. Want to do it again? Tell me when you stop hearing now.
No.
Okay. Of course, his air conduction was lower than his bone conduction, which is a normal finding. Okay, sir. I want to look up in your nose after I check your ears, okay? For the purpose of this video, I'm only going to do this ear over here where they can see me, okay? I'm going to turn the light on first, sir. Sorry. Okay. Your eardrum is intact. There's no ruptures. It's nice, pearly and white. I can see the ombo. I can see the malleus. I can see the cone of light. So no issues there, sir. I can see all your structures okay in your ear, and they appear to be okay. You do have a little bit of drainage in there that you may, and flakiness in your ear that you may want to work on. The other thing I need to do, sir, is I need to check your sense of smell, okay? I'm going to have you to plug one of your nostrils. Let's plug your right one since I'm only doing one side. Or your left one, I should say. Yeah, your right one. This one. My left, your right. Sorry. Okay, close your eyes for me. I'm going to have you to smell something. You're going to tell me what it is. Smells like vanilla. Okay. Now, keep your eyes closed. I'm going to have you smell one more thing. And it was vanilla. Oh. If I can get the lid off of it. Sorry, sir. Mint smell. Okay, vanilla and mint. So those were correct. Sir, I'm going to look up in your nose. I'm checking your nose right now. It appears to be midline. The collar appears to be the same. The temperature feels the same in both sides. Okay. Nostril is nice pink, moist. I do see the landmarks in the nose. I'm only able to see one up on the left lateral side. Do you have any issues with your nose, sir?
No.
Okay. Can you open your mouth for me? I'd like to do a couple tests in there, and I'd like to check your teeth out and stuff. Let me grab my gloves over here on this counter, and I'll be right over here to get. I want to check your tongue and your. I got to check your blind pouch and stuff like that. Okay. Okay. I'm going to be checking your hypoglossal and your vagus nerves now, and that's when you say ah. Okay. Any questions?
No.
Okay. Go ah. Gag reflex is intact. The ah, when he said ah, his uvula was midline. I didn't see anything there that would indicate distress. I want to look in your mouth again and check your teeth. Make sure you got good teeth in there. Open up for me. He's got about 15 teeth. There's some dental caries and there's staining. Do you smoke or rub, sir?
Yes.
Which?
Rub.
Okay. I'm just checking in the side of his mouth for his blind pouch. I do not see anything in there on both sides. Okay, sir. That concludes our mouth test. Now, I want to check your chest and your lungs, okay? If you can do me a favor, I would greatly appreciate it. Take off your shirt for me so I can look at your chest. I'm just going to do an inspection. Okay. I'm looking at his chest. It appears to be his rate and rhythm of his respirations appear to be normal. There's no issues there. He has good skin color. He's not in respiratory distress. I don't see any use of accessory muscles. If I was going to do his breast, at this time I would say his breasts are nice and midline. Are you having any discharge from your nipples, sir?
No.
Okay. And then his axillary lymph nodes, if I was going to palpate them, I would palpate up here in the area, and then I would have him to raise his arms and palpate up in under the axillary area. But for time's sake, we're going to skip that part. Let me just do your chest. Okay, I'm going to tell you to, we'll touch your chest. I want you to say 99 when I do.
99, 99,
Okay. Now I'm going to do a percussion on your chest, and then I'm going to listen to it, okay? Okay. Take a breath for me. In and out. His chest is nice and symmetrical. I heard resonance when I percuss. The collar is good. I have you to sit up, sir, so I can listen to the back of you. I want you to do the 99 again when I touch you, okay?
99, 99, 99, 99.
Okay. When I percuss. Okay, sir. I'm going to listen to your back and then you're done. Take a breath for me. Okay, lungs are nice and clear. I don't hear anything in your lungs, sir. The next thing I want to check is your heart sounds, okay? So I'm going to be doing a couple tests up here. First of all, I'm going to check your point of maximal impulse, which is 5 intercostal spaces down mid area. I just want to make sure you don't have any thrills, bruise, anything like that I'm feeling when I palpate. I'm not feeling anything. Then I'm going to check your heart sounds. I'm going to check your aortic, your pulmonary, your Erb's point, your tricuspid, and your mitral valves. So, second intercostal space on the right is your aortic. Okay. Okay, I'm going to check your shoulders while I'm up here. It's part of my muscular assessment. I'm going to just check them for tone. Collar looks good. Even hair distribution on the chest, the belly, and the arms. Can you do me a favor, sir? Can you bend your shoulder like outwards? Raise it. Bend the elbow like you're flexing your elbow up to hit yourself. Okay. Don't let me push it away. Okay. Okay, pull it in. Okay, good. Okay, now while I'm in this area, I want to do a muscle test on your neck. Okay, I'm going to have you to turn your head, and I'm going to have you to resist me, like towards me, push pressure towards me. Turn your head to this side. Okay, now over to this side. Okay, back. And while we're here, I'm going to check for nuchal rigidity. Can you bend your head as far as you can to your chest for me? Any pain when you do that, sir?
No.
Okay. Doesn't appear to have any nuchal rigidity as well. Okay, now I'm going to, his belly looks okay. I don't see any issues, no lesions, no masses, no issues with his skin. Whenever he takes breaths. His respirations are nice and even. I'm looking for peristaltic waves or any masses or anything like that. I want you to kind of set up so I can make sure you don't have any hernias. Can you set up a little bit? There appears to be a little bit of a bulge right there, maybe a little bit of weakening in the wall of the stomach. That might be something that he might need to get checked out later. I'm going to listen to your belly. I'm going to be listening for aortic, iliac, or renal and femoral arteries. And at the same time, I'm listening for his vowel sounds in all quadrants. Due his time. Okay, sir, I'm just going to go under your shorts just a minute to listen to your femoral. Okay. I need to check your liver borders and your liver. I'm going to go over on this side, and I'm going to go up underneath your rib cage there a little bit, okay? Mark that right there. Okay, sir. I want you to do me a favor. I'm gonna we'll have you take a deep breath here in a minute. Take a deep breath. Okay. I feel his liver coming down and touching my fingers, so it's not enlarged. And for the sake of measurements, his liver span is 3.5 centimeters, so that's within normal limits. Next, I'm going to check your spleen over here, sir. Take a deep breath. I should not feel any spleen, and that's normal, sir. I'm not feeling anything, okay? Okay, the next thing I need to do, I was going to have you to lay it on your left, but from what you tell me, do you have any problems with mobility?
I got muscular dystrophy.
Okay, and you have trouble getting on your left side?
Yes.
Okay, so is it okay? Do you want me to not do that test on you?
Yes.
Okay. Pericardium. I do not see anything there. Okay, I'm going to give you a number in your hand, and close your eyes. I'm going to write a number, okay? And you tell me what number it is.
5.
Okay. Now I'm going to put something familiar in your hand. Keep your eyes closed for me, and I want you to tell me what it is, okay? Feel it for me and tell me what it is.
Sounds like a marker.
That's correct. Thank you. Okay. Now I need you to do me another favor, sir. I need you to kind of set up. We're going to do what they call a slump test on you to check your spine to make sure you don't have any nerve root irritation. Okay, can you sit up a little bit for me? Before we do that, I'll check your pedals and your radials and all that stuff. Okay, radials are good. Can you lift up your foot for me? Okay, let me see if I can get that computer around here so they can see us. Sorry. Okay, let me see your foot, sir. Okay, and then I'm going to check his left inner aspect. Let me check it on this side so they can see it. Now, while I'm down here, sir, I'm going to do what they call the Babinski test, where I'm going to take something and I'm going to run it across your foot. Flex your leg for me. Okay, the Babinski test has been done, and that's a normal finding. Okay, I need to do like a microfilament test on you. Can you close your eyes for me? I'm going to ask you if it's sharp or if it's dull. Okay, you tell me which it is. Okay.
Now it's sharp.
Okay. This?
Dull.
Dull. Okay. Let me check your feet.
It's kind of short.
Okay.
Kind of dull.
Okay. While we're checking things, can you take your glasses off for me? Because I forgot to check your eye, your collar under your eyelids there. And make sure that they're okay. Sorry about that. When you look up, can you look up for me? Okay. He's got good collar under his eyelid there. Conjunctivis looks okay. Okay, I'm going to take and flip your eyelid up for me. Okay, they look nice and pink. I don't see anything under there. Now I need to do some reflexes, sir, okay? I'm going to check your arm. Any problems there, sir? Can you feel it?
Yes.
Okay.
Ow.
Your finger should move whenever we're doing it. Let's see if we got it right. Just a little bit. Okay. Any issues there? Okay,
No.
can you raise your knee up for me? Okay. Your leg doesn't appear to want to. Let's hang your leg off that bed there a little bit, sir.
That's my
Or the
worst.
chair.
That's the worst part of my MD's in the leg.
Okay. So that's why you don't have a lot of filling down there?
Yes.
Okay. Is this reflex normal for you when you go to your neurologist?
Yes.
Okay. Okay. As you can see, because of his muscular dystrophy attacking his muscles, he doesn't have a lot of reflux down there. Now I need to palpate your major joints and inspect your spine, sir. And we need to do one more test after that, okay? push me away. Checking your muscle strength. Pull me towards you. Okay, you got good muscle upper body strength. Now I'm going to come down here and do your leg. Lift your leg up for me, sir. Okay, push me away. Weaker in the legs. Pull upward. Don't let me push you down. Not really good. Okay. I want you to open your hands for me. Okay. Now, don't let me close them. Okay. Okay. Now, open them again. Close them. Okay. Now, have them closed. Don't let me open them. His finger strengths, as you can see, I'm opening his fingers. Okay, so his body strength, because of his muscular dystrophy, is not really good. The muscular dystrophy is taking a toll on his muscles. Sir, I have one more thing. I need you to lean up so I can get your spine, please. Okay. Any problems there, sir? I'm inspecting your spine and palpating it. The spine looks okay. It looks intact. I'm going to try to pull the computer over here so they can see what we're doing. His spine looks okay. It looks intact. I'm palpating it. It doesn't look curved when I run my fingers down it. So it appears to be intact. The other thing I need to do is I need to do a vibration tuning fork on your feet to check your vibration in your feet, okay? I know. Okay. Did you feel that?
No.
Okay. As you can see, that's impaired because he doesn't have any filling in his, that he has decreased filling in his legs. Other than that, I need you to do a slump test for me, where you sit up and you slump over, and I'm going to have you to raise your leg and see if you have any issues in your lower spine, sir.
My legs won't raise
Okay, so,
from like that. Forget it.
okay. Can you show me how you get out of the chair, sir? I want to see the Gower position. It's okay. I just want to show. Wait a minute here.
Get up.
Wait a minute. Trying to get it back to where they can see what you're doing. Okay. That is the Gower position. And I want you to look at his, calves. The calves down at the bottom are enlarged, which is typical with patients that have muscular dystrophy. So if you see that, you really want to do a screen on those. Thank you very much. That concludes my video of the neuromuscular, or the muscular skeletal system.